Channel 114. Channel 114.
Tonight on the VC3 News Update, persons utilizing dialysis treatment services at the Modern Medical and Diagnostic Center in Georgetown will benefit from a further subsidized cost. Police Commissioner in St. Vincent and the Grenadines, Colin John, has welcomed the training being provided by the St. Vincent and the Grenadines Coast Guard Service. And North Leeward would see significant enhancement to sporting facilities in the upcoming months. We'll have these stories and more tonight at 7 p.m. on the VC3 News Update.
On Friday, August 14th, there'll be thousands of dollars to be won. A lotto jackpot of $67,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $67,000.
Good evening and welcome to another edition of Roundtable Talk for today, Wednesday, August 12, 2020. We are talking medicinal cannabis this evening. I'm sure that many people think that since the COVID emergency, so to speak, that nothing has been happening. This is far from the truth. Lots and lots and lots of things have been happening at the MCA. And to talk this evening with us, we have the medical officer at the MCA, Dr. Jason Young, and the drug inspector and INCB liaison officer, Fiona Denny Pay. I always get confused with the double barrel name, but yes. Fiona, as we call it, we all call her Fiona. Welcome, colleagues. It's good to have you with us on another Wednesday.
Thank you for having us.
You've been here before, Doc, and it's your first trip.
Yes.
So, welcome.
Thank you.
I want to start off the discussion by asking, first of all, what you guys do, your role and function at the MCA. For instance, you are the medical officer on staff.
Yes.
Why is there a need for a medical doctor on staff, and what exactly is your role and function in this position?
Well, as the medical officer and staff, I am charged with the responsibility of research into the various conditions that are allowed to be treated with cannabis. We have to set up training and so for physicians and pharmacists, and we're also working on training for nurses and farm techs and the like. We also charged with events like this, getting the word out about medicinal cannabis, how it can be used.
Public education?
Sorry?
Public education.
Public education. And well, I'll let Fiona get into where she comes in.
Well, Dr. Young and Jason, as we say, we work closely together. As the drug inspector, I work mainly on the regulatory aspects of medicinal cannabis as it relates to patient access. So I work closely with the pharmacies and the pharmacists. Yes, that's what I do. And as the INCB liaison officer, I am responsible for linking and reporting to the INCB. Really is the narcotic or the control drug arm of the United Nations.
So it's actually the International Narcotics Control Board.
Yes. So
the enforcement arm of the UN.
Yes.
Right, and we also, but before I forget, we also work very, very intensely on the patient access regulations, which, by the way, were gazetted on May 6th, and so they are enforced now. And so we are working on that on bringing all of the aspects of patient access online, so to speak. So we're working now on ways to get product into the pharmacies that can be prescribed, and we are in the process of approving trained physicians who are ready to prescribe, and we are also working along with the pharmacists to make sure that all of the tracking is in place and so on. So it's quite a lot,
a gamut of work there. Patient access has been one of the things that the staff has been busy working on. Tell us, what are we talking about when we refer to patient access? What do we mean here?
So when we say patient access, we're talking about patient access to medicinal cannabis. And it's quite involved. Some people think it's just that, the comrade free up the weed, but there's quite a bit more involved. For example, the main thrust of the patient access regulations is that patients who need it and can benefit from medicinal cannabis should be able to access it, and that unauthorized persons and that cannabis should not be diverted to unauthorized persons like minors, should not be diverted to the illegal market, the illicit market. Right? That's the general thrust of patient access. In order to do that, it meant that we had to have authorized physicians, licensed pharmacies. We have to have authorized pharmacists as well, and we have to have licensed producers and safe product, which means testing and inspection by our inspectorate. Mm-hmm. So patient access gets everybody involved. You have to have the licensing team involved to do due diligence on our licensed manufacturers and on the pharmacies, and you have to have the inspectors going around to make sure standards are met. Yes. So patient access kind of it troubles everybody in the authority. Yeah.
What would you say are some of the issues surrounding the whole question of patient access as it relates to medicinal cannabis?
In terms of as it stands right now, I think one of the main areas that may give us a bit of not so much even a setback or a problem, but a small delay is the availability of product. Right? A lot of, in terms of product that contains THC, is because of the way it's been classified and by the INCB and by the United States, is not easily available. And when product that is easily available may not be safe, right? It has to be tested to be free of heavy metals, insecticides, microbial toxin, microbes themselves. And so we are making progress in terms of getting product. Initially, we will have to import product until our own manufacturing arms come up to speed. I could let Fiona mention a bit more about that.
The good thing about it is that our health professionals are excited. Mm-hmm. We have pharmacists, we have medical officers who have already submitted applications to be authorized to prescribe and dispense. We also have pharmacies that have submitted applying for a dispensing license. And we also have our first application for a medicinal cannabis only pharmacy. So that's a license that can be granted to somebody who does not have a traditional pharmacy but sells only, provides medicinal cannabis only in that pharmacy, any product.
Okay, so there's actually somebody who has applied.
Yes.
Well, I don't know if I should ask if it's local or overseas.
I would say it's an overseas investor, but there are persons on the team who are locals. The staff would be local, the pharmacist would be local, product would be local, some of it. Yes, but it's an overseas investor, but the staff is heavily Vincentian.
I want to look a little bit at the legal requirements. What are some of the legal requirements one would need to have in place, or in fact already in place, to facilitate patient access?
Well, I'll let Fiona handle the pharmacy side of it.
Okay.
Right? So in terms of patient access, we had put on last year a series of training programs, right, to bring doctors up to speed on things like the endocannabinoid system, administration and dosing of medicinal cannabis, the forms and routes and so on. And that was a major hurdle that had to be crossed, because many people may not realize it, but the endocannabinoid system was not known about until the 1990s. So most medical schools haven't even started to really teach about it as yet. So in order to bring our medical professionals, pharmacists and physicians up to speed and have them ready to be able to prescribe and dispense, we had to put on those trainings, and that's one of the major hurdles that we crossed. Towards also for the training other professionals, we have been scouring the net to look for sites that we think can offer content that would also bring out that our professionals could access online, and once they present proof that they've completed the course, that we would accept it as them being trained as well, so that they can have access to this training beyond us having to wait for us to put on another training course. Okay. In terms of the pharmacy side of things, in order to have qualified to participate in these training programs, you would have to have also been a certified local doctor. Right, you'd have to have been registered with the medical board, and that would have made you eligible to participate in the training course. And successful completion means that you can now apply for authorization to prescribe. Right, so just simply attending the training course is not enough. You have to attend. You submit to us an application along with proof that you've completed the training course, and the team at the MCA reviews it and determines whether or not to grant you a certificate of authorization, which is valid for a period of 2 years. I'll let Fiona talk about the pharmacy side of things.
Well, basically, as a pharmacist, and we need to really bear in mind the whole issue of access. Access, according to our laws, the Medicinal Cannabis Act, is that you have to access it through a physician. You cannot buy it on the corner street. Not because you hear it's legal, you have to actually go to a physician, and the physician, yourself and your physician deciding that this is something you want to use. He would recommend, write a prescription, and then you take the prescription to the pharmacy, where you would be able to get up to 1 month, depending on what you want. And the thing we have to remember as well is that in some countries, they are limiting what you can use. In St. Vincent, our laws is as long as your physician has written for medicinal cannabis, you are allowed to use any form, whether it's the dry buds, whether it's smoking the dry buds, whether it's orals, where you can use caplets, tablets, there are tinctures and oils, there are patches, there are creams, there are a wide variety of products that are available on the market.
And we'll talk some about the products and also about what are some of the qualifying conditions
yes.
that you can actually use medicinal cannabis for under the laws of St. Vincent and the Grenadines. We'll be back in just a moment.
One scratch card, 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpot. Loaded with lots of cash prizes. $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpot. There's cash to catch with just a scratch.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
$529,100. Yes, that's the Super 6 jackpot. This Friday, August 14th. Super 6, more jackpot money.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Welcome back. Fiona, before the break, I think you were developing a point, and then we wanted to also talk about what are some of the qualifying medical conditions under which medicinal cannabis can in fact be administered here in St. Vincent.
Well, currently we have 20 conditions. There are some countries that have more, there are some countries that they have less. But some of the common disease conditions that cannabis can be used for any disease condition, such as we have like pain associated. You can use it for pain associated with cancer. You can use it for vomiting and nausea due to chemotherapy. There's glaucoma, sickle cell, and the list goes on. There's autism. You have depression, certain epileptic conditions, seizures. Yes. But
and all kinds of pain.
Yes,
pain,
yes,
chronic pain,
any inflammatory conditions where they have discovered that cannabis can be used to treat.
So there are 20.
We have 20 currently. But the list can be shortened as well as it can be extended.
It would have been nice if we had that list that we can put up alongside there for those who may be interested. But probably we'll get that done later on in the program. We can get that done. Is there an authority that is responsible for overseeing this entire process in terms of medicinal cannabis locally?
Yes, we do have Medicinal Cannabis Advisory Council, and it's made up of medical personnel. It's made up of persons in the community. It's just a community. It's a committee where they would look at matters like this, ethical issues in working along with the Ministry of Health, as well as deciding if a condition should be removed, if there's a recommendation that there is another condition that's not on our list, and we want to make recommendation to them. We can present the case before them, and they're the ones who decide whether we add conditions to our list.
Whether a condition stays or goes, or if one comes on.
Yeah.
Okay. I want to go over the process again involving how someone should go about accessing
a patient.
Yes.
Right. So, as Fiona had said before, we would start with the physician. Right? So the patient comes to see the physician. The physician takes the history, does his examination, and he determines that they have a qualifying condition. So maybe they have some form of neuropathic pain. Maybe there's nerve damage and it's resulting in pain. Maybe from a diabetic neuropathy, let's say. Right? If the patient, he may discuss the options with the patient. If the patient wants to try cannabis, the physician will go ahead and fill out the prescription. They'll go ahead and do a registration form for them, for the patient, and they will also fill out a temporary ID, right, which says, if the patient is stopped with cannabis for any reason, I am a patient who has been prescribed cannabis and I'm allowed to have this. Right, and
a medical certificate as well.
The medical certificate of registration. Yeah. So once all this paperwork has been filled out, the patient can now go to an authorized pharmacy and have the prescription filled. The pharmacist may even run over exactly how to administer the medicinal cannabis with the patient, make sure they're clear on how to use it. All right, and they can now go ahead. From there, the pharmacist will have done. We have what is known as the St. Vincent and the Grenadines track and trace system. The information will be input into the system, right? And from there, they can go to the medicinal cannabis ID unit, which should be located upstairs in the post office. And they will be able to go there, take an application form that they also get from the doctor and their ID, the temporary ID, and their temporary ID will be replaced with a permanent ID that will be valid for 1 year, right? So that nobody can stop them if they have the scene with medicinal cannabis and say, should you have this? They have the ID, they have their registration and they have the ID card.
Okay, so upon registration, a patient is issued with an ID, a special ID.
Yes.
Okay.
And this is done because we want people to remember, although we have the Medicinal Cannabis Industry Act passed and the Patient Access Regulations passed, and it allows patients to be prescribed medicinal cannabis through their doctor. Any other use of medicinal cannabis other than the medicinal use as prescribed by a doctor still remains illegal. It's still an offense. What has happened is that there's been an amendment to the Dangerous Drugs Act that allows a person that they might have up to 56 grams of cannabis on them, and it will be a ticketable offense, more of a civil offense. You won't get a criminal record. If a person still shows up on the scene with 200 grams of cannabis and a firearm and so on, there's going to be a criminal offense, and they still face the full brunt of the legal system. Right?
Okay, and suppose someone tries to use an ID that does not belong to them. What happens?
Well, the St. Vincent and the Grenadines track and trace system, which is a fairly sophisticated system, they will be caught. That's the bottom line. They will get caught.
Tell us a little bit more about the track and trace system.
Track and trace system. Well, the Medicinal Cannabis Authority entered into an agreement with Ample Organics. This is a software company out of Canada, and they are setting up the St. Vincent and the Grenadines track and trace system for us. Right? It's a system with two arms. One arm of the system is geared towards tracking and keeping a check of what is produced from the manufacturers and the cultivators. And the other arm of the system is the patient access arm, which it will monitor how pharmacists, doctors, and patients interact in the system and who has cannabis and it will afford us that degree of traceability. It will also afford us the ability, for example, if we discover that product was tainted, right? We could trace and recall that product before harm is done to a patient. You know? And so and it's required under the INCB regulations and so on, that we have that kind of a traceability system.
Yes.
Okay, I gather there's a question. Somebody wants to know, sometimes drug tests are requested for certain countries to either go on duty or training and for immigration. How is this going to affect the process if you are using cannabis as a medicine? Interesting question.
You want
Well, of course, as we said before, you will have the evidence to show that you've been diagnosed with, you're a patient and you've been diagnosed with with a qualifying condition. You'll have your medical certificate if you need it, but more likely on that you will just need your ID to show that I'm a patient and I'm allowed to have this. Yeah.
But how will this work in jurisdictions where cannabis is still considered to be not legal?
Well, these documents are valid within our jurisdiction.
Yeah.
In places like the United States, it's still a federally restricted substance. Some states allow it, some states don't. So it really depends on which state you land in. Most territories in the Caribbean now are moving towards legalizing, at least for medicinal purposes. Barbados,
many European countries as well.
Mm-hmm.
But it's really a good question because you would have to really do your research and find out what is that country's position on medicinal cannabis, and then we'd have to figure it out. But it's legal here as medicine.
Yes. Okay. There's another question. What of a visitor on a yacht or cruise ship or just here for a day? How can they get it?
We have made provisions for that.
There are several pathways. There are 4 pathways through which a person could legally receive medicinal cannabis, right? So, for example, I'll list them. You have what we call the local patient, which is just a regular intention. They go to see an authorized doctor. They diagnose with a condition, and they follow basically the same path we described before, and they get their ID, and they're able to access medicinal cannabis from the pharmacy, right? We have what we term as the medical tourism patient, right, which is a patient who comes in, whether it be for a day or a month. They're not citizens of St. Vincent and the Grenadines, but they can go to see the authorized doctor, whom, if he diagnoses a medicinal cannabis, a qualifying condition, may decide to prescribe them medicinal cannabis, and they basically follow the same path. They will receive a temporary ID. They probably they will not get a permanent ID, right? So that by laying the jurisdiction, they can access medicinal cannabis for their needs. And that temporary ID will be valid for about 30 days, right? So that should give them, enough time. We also have what is known as the visiting qualifying patient under the regulations. So this is a patient who was diagnosed with a qualifying condition in another jurisdiction, right? Maybe Barbados, St. Lucia, maybe even the States. Mm-hmm. They come already bearing their medical certificate, and they are from that jurisdiction where they're from, and the prescription from also from their home jurisdiction. So once they come with these documents, amendments have been made to the Pharmacy Act, right, to allow them to come with their registration, their prescription, and their valid travel document, and they can go to the pharmacy and have that prescription filled. Right.
Okay.
And then finally, we have what we call the visiting patient. This is a patient who may be seen by a local physician before they arrive using telemedicine, right? So that we have been investigating telemedicine platforms to allow this. So a local authorized physician is able to connect with the patient before they arrive. He's able to diagnose the condition. He can prepare a registration document for them. so that when they arrive, they have their registration number in the St. Vincent and Grenadines track and trace system. They go straight to the pharmacy with their valid travel document and their registration number. The pharmacy should be able to pull up their registration document, and using that document, they will issue the patient the document and the medication that is prescribed on the same registration document.
Okay, we'll take a second break and come back in just a moment.
Tonight on the VC3 News Update, persons utilizing dialysis treatment services at the Modern Medical and Diagnostic Center in Georgetown will benefit from a further subsidized cost. Police Commissioner in St. Vincent and the Grenadines, Colin John, has welcomed the training being provided by the St. Vincent and the Grenadines Coast Guard Service. And North Leeward would see significant enhancement to sporting facilities in the upcoming months. We'll have these stories and more tonight at 7 p.m. on the VC3 News Update.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
$529,100. Yes, that's the Super 6 jackpot. This Friday, August 14th. Super 6, more jackpot money.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
On Friday, August 14th, there'll be thousands of dollars to be won. A lotto jackpot of $67,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $67,000.
Welcome back. At the last break, we were talking about the 4 pathways to accessing medicinal cannabis here in St. Vincent and the Grenadines. Want to talk a little bit about where does the MCA come in all of this? You have the patient, the medical professional, and also the pharmacist. So at what point does the MCA come in? But just before we talk about that, I think we have a question. Is there a cost associated with this patient's ID? Okay, good question.
Yes. There is a cost, but for locals, your temporary ID is free. So you pay nothing, right? But for your permanent ID, if you're a patient, you pay $20 EC. If you are a caregiver, because we didn't really address the caregiver, the whole aspect of patients who would need somebody to assist, they too would receive an ID, a caregiver's ID, right? Their ID costs $10 EC. A foreigner who's here for a day or for a short period of time, their ID is 55 EC for that, whether for 1 day, 1 month. Yes, and what was the other? Yes, so it costs.
So yes, there is a cost.
There is a cost.
Yes, and your permanent ID is valid for a year, so you have to renew that ID on a yearly basis.
Annual basis.
Yeah, annual.
So I wanted to talk a little bit about where does the MCA fit into the entire process?
The MCA really, we are regulatory, but not only regulatory, but because this is a new industry, our health professionals and our farmers and our manufacturers, they are still looking to us for guidance. So we support in terms of providing what necessary training, whatever information. So we are the mothers of the medicinal cannabis industry, I should say. So what we do is that what happened is, say for example, a physician, you can be a medical officer here, registered in St. Vincent to practice. But if you're not authorized by us, you cannot prescribe medicinal cannabis. So they have to come to us. Same, even though you may have an established pharmacy, you still have to be registered. You have to apply to the MCA for a dispensing license so that you can dispense medicinal cannabis. Same for the pharmacists. They too have to be authorized by us. So it's just not automatic because you're already a health professional here that you can just go about and deal with medicinal cannabis. Everything has to come through the authority.
So what kind of control measures will be in place to ensure that these things you mentioned are in fact adhered to?
A big help in that regard, of course, is going to be the St. Vincent Grenadines track and trace system. Right? Also, too, copies of prescriptions and medical certificates and so on that are written by physicians. The copies all eventually come back to us at the MCA, right? Yes. So that if anything appears to be out of order, we can raise the query with the professional in question, whether it be a pharmacist or a medical doctor. And we don't think that will be the case, but should behavior become more concerning, the option is there to send the person a notice, right? Yes. And if the notice is ignored, the option is still further there to suspend authorization and to investigate matters and clear them up before authorization is restored.
Or even revoked.
Or revoked,
somebody's license, depending on the nature of the issue, their license can be revoked as well.
So the present situation is that local doctors can in fact prescribe medicinal cannabis right now in St. Vincent?
Yes, that's right.
Once authorized.
Right.
Once authorized.
Once authorized, yes, they can. And as we said before, the other side of it is making sure that product is available.
Yes.
Right?
So that was the follow-up, because I'm thinking now that the product is not really available locally as yet.
Yes, yes.
So
it should be available shortly. We are making the arrangements. We made all the contacts, and there are pharmacists who are seeking authorization who have also begun to make contacts, and so product should be arrived shortly.
Yes.
So we will be in fact importing some products until
on
our market
basis,
is
right.
Yes,
and
because
especially go ahead,
sorry, because for import purposes, it's the MCA that gives import permits.
Yes.
So that we are able to, as Fiona says, we are kind of nurturing the industry. We will be the ones kind of deciding how much product can come in. Yeah. Right, and we have good reason to look at that carefully, because we have to protect our local producers. Yeah. We don't want market to be flooded with substandard stuff, so we have to protect the patients, and in that regard too, we're also protecting basically the public morality, because if you flood the market with a bunch of substandard stuff, you will certainly, as Dr. Thompson likes to say, you have fellas stand up down by the market saying 2 for 1.
Yes.
You know, so that's not a situation that we have to look at very carefully.
Yes. But products are there from the time we actually went legal, where we are allowing medicinal cannabis. There have been different companies abroad who already have legalized and are selling product that show interest here, and have contacted our pharmacies, expressing interest in doing business. But as Jason said, we are very mindful, and we are choosing carefully what would be imported, mainly products that we know won't be available locally, right? Because, say, for example, for glaucoma, in the short term, these eye drops, the eye drops to treat glaucoma, which is called Canasol, is one of them, would not be available But this is a product that has been used in St. Vincent in the early 90s here to treat glaucoma, made from cannabis. So products like those and maybe gel caps and tablets that we won't have around until maybe next year or so, depending on how the industry deals with the manufacturing side of things as it relates to those drugs. So, but our local pharmacies are interested in purchasing locally, so it's not really a challenge for us at this time. They're excited about being able not to have to import much.
I see you walked with some products
yes,
today.
Yes, because we have found from our outreach and from dealing with the public that people know what the buds look like, the flowers that the guys would smoke, that people would smoke. But we do have different preparations, and this for one is a spray. This is a spray made from cannabis that you spray under the tongue, right? So persons who may be interested in wanting to try or would have done their research and realize that cannabis is something that they would like to try, but they would not opt for smoking. They would prefer to use like the oils, the spray, you spray it directly under the tongue, and it's absorbed and it goes into your bloodstream and does what it has to do, as well as drops. These are some of the liquids as well. So we do have final products that aren't buds, so do not be scared. Be willing to try.
What about the whole question of dosing and so on?
Yes, well, it depends on the product. With medicinal cannabis, it depends on what you use. Say, for example, if you smoke, that happens quickly. You get an effect really quickly. I'm trying to keep it too medical, so I'm trying to explain it in a way that the general public can understand. For example, if you smoke the cannabis, you get an activity within 3 to 5 minutes of smoking. You know, it lasts for about half an hour and then it wears off. So then if you opt for smoking, you have to use quite a few blunts, as we call it, a day. But say, for example, you use gel caps or tablets, they stay in the system for a longer time. If you use, say, for example, patches that are made, they are even long-term. You can use a patch like for up to 12 hours, you can have relief. Yes, so it all depends on which you choose to use will determine how long the duration, how long you'd have to use it for.
And you generally you have better control with the gel caps and the oils.
Yes.
Because if I prescribe you 1 mil, one mil, and we say 1 mil has in 5 milligrams, it's easy for you to see that I've pulled up 1 mil and I drop that on my tongue. You see, controlling dosing with the inhalational methods is a bit more.
Yeah.
It is not as reproducible. You know? And also, in our jurisdiction, we haven't ruled out any form of administration, which includes the smoking. But as a physician myself, I would prefer that people not smoke.
Yes.
Because you still have all of the illnesses that are related to smoking.
Yes.
Yeah.
Are there any safeguards for the use of medicinal cannabis?
Well, yes. It's the same, basically the same safeguards as for any medication.
Yes.
The doctor prescribes, tells you how to use it. You go to the pharmacist, they explain how to administer and so on. And just like any other medication, we hope that the patient will be compliant.
Yes.
Yeah? Some patients, in any other medication, some patients don't like taking tablets, and they don't take them as regularly as they should. And that may happen with medicinal cannabis as well. And then there are those patients who are overeager, and they take much more than you
require dose.
Yes, you require dose. And you have to sit with them and say, no, you can't take this much. You have to stick to this dosing regimen. And very often, most of what we've seen, the training that we've been exposed to, it shows that physicians and patients have to be patient in terms of medicinal cannabis. Yeah. There's no magic bullet, and everybody responds differently to medicinal cannabis. So the mantra that is start low, go slow. Right, yes. And the doctor may ask a patient to start off at 2.5 milligrams, And if you you begin to get some effect, but it's not the full effect, you may gradually increase over a number of weeks. And once you'll find that you get to that spot where you're getting the benefit that you want without getting the high, right? What do you call it? The intoxication, right? So there's that whole concept of microdosing, right? You're getting the dose that gives you the effect that you want without getting that intoxication. Yeah. Mm-hmm.
Okay, when we come back for a final segment, we talk a little bit about drug use and abuse and misuse.
Okay.
Back in 60 seconds.
One scratch card, 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpots. Loaded with lots of cash prizes. $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpots. There's cash to catch with just a scratch.
Tonight on the VC3 News Update, persons utilizing dialysis treatment services at the Modern Medical and Diagnostic Center in Georgetown will benefit from a further subsidized cost. Police Commissioner in St. Vincent and the Grenadines, Colin John, has welcomed the training being provided by the St. Vincent and the Grenadines Coast Guard Service. And North Leeward would see significant enhancement to sporting facilities in the upcoming months. We'll have these stories and more tonight at 7 p.m. on the VC3 News Update.
Welcome back. Just a reminder that you can make your contribution to the program by sending your questions via Facebook and YouTube. Before the break, I mentioned that we want to look a little bit about the whole question of misuse and abuse of drugs. I mean, like everything else, one is likely to get that kind of situation with this new dispensation. What are some of the things that will be put in place or are being put in place by the MCA to deal with this?
Well, the things being put in place in terms of, we mentioned, of course, the track and trace system. Well, we have partners also in the wider society. Of course, we're going to be working along, of course, with the police. And in terms of the system of tickets and so on, that's allowed under the amendment to the Dangerous Drugs Act. Mm-hmm. We've been working with doing sessions with the police and bringing them up to speed. And
before you continue, there's a question, so we'll come back to some of the measures being put in place. Can someone come into St. Vincent with their card? Will that be okay for them to get a card? I'm not sure that I get that. So it should be maybe if someone is coming without their card, if it would be okay for them to get a card locally. That's my interpretation of that.
They must have some valid form of identification. Must have some valid form of identification. And most often than not, if they're coming from outside of St. Vincent, we would prefer them to have the valid travel document as the reference point.
Okay. So, okay, I think I get that. So, Doc, you were talking about some of the safeguards that would be put in place for...
Right. So, of course, one of the things that has been happening recently is that we talk about this period of tolerance, right? And if that period of tolerance is intended to encourage people like the traditional cultivators who may be still up in the mountain and may think that it's just applied to, some of them have expressed that it just applied to get us to come down and they go hold us.
Yeah.
That's not the case. The period of tolerance is meant to encourage them to come down and to get involved in the industry in a legal and safe way, right? In a way that they can enjoy regular returns and not have to be fearful of loading a boat in the middle of the night and somebody shoot them down, that kind of thing. And after, at the end of this period of tolerance and so on, you realize you're going to have to get back into serious enforcement, and in which case we have our own inspectors who will be going around to the manufacturers who are keeping the farms and keeping track of what is produced and where it goes, right? Remember, the track and trace system does that too, but we have our inspectors who go out and make sure that what you say you're doing is what you're complying with what the standards and the requirements. Also, too, we mentioned that at the end, the police are going to have to begin to get back into at the end of tolerance, into enforcement, right? That you wouldn't have somebody walking around the market with 200 grams saying to get it here, and that sort of thing. Fiona, you have anything to add?
I would just say the fact that the limited amount that you can have, a patient is only allowed to have a 30-day supply.
Right.
Right? So after every 30 days, you have to see your physician again to replenish that prescription. You would not be able to repeat a medicinal cannabis prescription. So we would definitely, we have done that as you say, to prevent people from abusing, as well as to monitor how much a patient has. Yes.
And the manufacturers are expected to diligently keep records that can be examined and compared against what is in your storeroom and that kind of thing. Mm-hmm. So the safeguards are there. I'm satisfied that they're there.
Mm-hmm. And from that individual level where you may have instances, you're likely to have instances of individuals who will abuse the drugs. Yes. I know that there are plans to work with the National Substance Abuse Commission within the Ministry of Health. Yes. Tell us a little bit more about that initiative.
Basically, that is us, because the MC is not just interested in having an industry where you make money. And as you said earlier, we know that there would be cases where people would take it as an opportunity to abuse. So what we're doing, we're working closely with the Ministry of Health, and the plan is for us to set up a commission that would deal specifically with substance abuse, phase 1 being mainly dealing with drug abuse. Because the thing about drug abuse and addiction is that it's no longer this bum on the street who you see was using cocaine, right? Addicts now, they have high heels, nice hairdos, the men are in shirt and tie, they're looking well. And you might, at first glance, you may not think that person is hooked on drugs. And it doesn't have to be an illegal substance. There are patients, there are persons who are addicted to legal substance, pharmaceutical preparation, and it's actually right here in our waters. We are encountering it. I've had several cases when I worked at the Ministry of Health where we had to deal with cases of persons abusing prescription drugs. So we want to do our part as well. We have our own initiative where we would go around mainly the educational aspect and anything that we can do to work along with the other stakeholders that deal with the whole issue of substance abuse, so that we can provide support and anything that. So definitely, we are committed to the whole issue of eradicating drug abuse, and therefore we are open to help anybody who so desire our assistance as we lead this charge.
So the MCA intends to play a pivotal role in this regard as well.
Definitely.
Before the whole emergence of COVID, we had actually planned an intervention. Well, an intervention in terms of doing a survey. Actually, you helped us prepare that survey.
Yes.
And so we were kind of waiting until things settled down to actually kind of administer the survey to get better idea on the ground in the communities. What the needs are, what the problems are in terms of substance abuse. In terms of medicinal cannabis, most of the literature says that actual addiction to cannabis is around, occurs at a rate of around 9% among users. Right? So it's relatively low in comparison to other substances. Mm-hmm. But our major concern in terms of recreational use of cannabis among young people, those under the age of 18, right? Every single study that has been done, they've all come back showing the same results. People under the age of 18, the younger they start using, the more likely they are to have serious mental illness. Yeah. That simply will not go away. We're talking about schizophrenia spectrum illnesses. And, I can't stress it enough. Young people under the age of 18, please do stay away from recreational use of cannabis. I can't stress it enough. Because these illnesses are degenerative disorders. Once you get them, over a period of time, you begin to lose skills, language skills, sporting skills, you name it. They are degenerative diseases. And I think that our people haven't taken it seriously enough over the years. You go out, I had worked briefly for a time at the mental health center. And more than 50% of the cases, usually on the male side of things, that are admitted to the mental health center, recreational use of cannabis is involved in some way, shape, or form. Right? And I don't want that for our young people. So please, young people stay away from the recreational use of cannabis. Because we see the difference between recreational use and medicinal use. Mm-hmm. The persons often using for recreation, they're using large quantities of high potency stuff. Mm-hmm. And you may find that they smoke 4 to 5 spliffs a day. A person using it for medicine now, they may take it's extremely low doses, maybe 3 times a day, maybe 1 or 2 drops under the tongue, and that gives them the effect they need. So that the exposures and the dangers are much greater for a recreational user. Sorry.
So there's a question: persons who are prescribed medicinal cannabis, if they want to smoke it, where can that be done? Can it be done in public? Good question from someone we know very well. There.
Yes. I don't mind. Medicinal, you can, your ID card allow you to have it in public, but you cannot be smoking on the streets. Hence, there is provision made for what we call a consumption lounge. This is where, say, for example, our tourists, they do come in and they can actually go there and medicate, right? But you are still not allowed, you cannot smoke your medicinal cannabis on the street. You cannot use on the street.
Go down the street
spaces.
And walk.
Right.
Okay.
Yeah, in restaurants and in buses and so on.
There will be designated areas for this.
Or the privacy of your, are you allowed to do it in the privacy of your home? Yes.
Okay. All right, folks, I think we are actually winding down today's program. Let me ask you, what's going to happen for the next few months? What's happening? What can we expect coming out of the MCA in relation to patient access, or what other developments can we look forward to?
Certainly, you're going to see more and more authorized physicians, right? Or more and more authorized pharmacists. As we mentioned before, we have trainings coming up for nurses and pharm techs and so on, because we do make allowances for medicinal cannabis to be administered in hospitals, and so the nurses and the farm techs and so on have to know what to look out for, and they have to feel comfortable administering it. And so we plan to make sure that they are trained so to do.
As well as you would see product on the shelves.
Yes.
It would definitely be available for use here. And we are really looking forward to the day when we can actually have what we call a legal first pharmaceutical products being manufactured in St. Vincent. Because all we do right now is we import. There aren't any other pharmaceutical products made locally. So medicinal cannabis is going to lead the way.
Of course, yes.
I think that's the perfect note on which to end today's program. Thank you very much, lady and gentlemen. Dr. Jason Young, who is the medical officer at the MCA and the drug inspector and INCB liaison, Fiona Denny Pay.
You got it right.
I got it right this time.
Hurrah! Yes,
Thank you for
having us.
listening. We'll see you again next week, Wednesday, same time, same place. This has been another edition of Roundtable Talk. I'm Teresa Daniel. Have a very pleasant Wednesday evening. Goodbye.